What does your mouth have to do with your fertility journey? In this episode, I'm joined by Dr. Katie Lee, a dentist, entrepreneur, and author who breaks down the powerful connection between oral health and reproductive outcomes, from specific bacteria that impact fertility to why your gums might be quietly sabotaging your pregnancy goals. We're exposing what really has not been talked about much at all. If you've been trying to conceive, are currently pregnant, or just want to feel better in your body, this is one you can't afford to miss. Welcome to the Birth with Power podcast, where knowledge is power and power transforms birth. I'm Dr. Nicole Calloway Rankins, mom of two and practicing board-certified OBGYN with over 20 years of experience and nearly 2,000 births attended. I've seen firsthand how the hospital system can leave women feeling unheard and uncertain, but that doesn't have to be your story. Here, you'll get the knowledge, support, and strategies to take charge of your birth experience so you can walk into the hospital feeling calm, confident, and empowered. Note, this podcast is for educational purposes only, and it's not a substitute for medical advice. See the full disclaimer at drnicolerankins.com/disclaimer. Now let's get to it. You're listening to this podcast, which is a powerful start. But if you want to go deeper, join the thousands of women who already get the Birth with Power brief every Thursday. It's my free newsletter with trusted tips, mindset shifts, and strategies that build on what you hear here, so you feel even more calm, confident, and empowered about birth. Sign up at drnicolerankins.com/email. Hello there. Welcome to another episode of the podcast. This is episode number 309. Whether this is your first time listening or you've been here before, I am so glad you're spending some time with me today. Today's episode is going to open your eyes to something you probably haven't heard before: how your oral health could be impacting your fertility and your overall wellness. My guest is Dr. Katie Lee, a general dentist, entrepreneur, and founder of the Collective Health Society, an integrated dental medical clinic based in Colorado. She's also the author of Saved by the Mouth and a vocal advocate for bringing oral systemic health into mainstream healthcare conversations. Dr. Lee gets personal about her own fertility struggles and shares the science behind how the mouth, particularly the oral microbiome, can influence conditions like endometriosis, PCOS, and even stillbirth. We also talk about the exact test, treatments, and prevention strategies that could change your reproductive outcomes. This conversation is fascinating and incredibly important. So without further ado, let's get into the conversation with Dr. Lee. Thank you, Dr. Lee, for agreeing to come onto the podcast. I am so excited to talk about this topic. It's so important and not enough people know about it.
Very few people know about the link between oral health and a lot of other things, but specifically fertility.
Yes.
So excited to be here.
Absolutely. So why don't you start off by telling us a bit about who you are and the work you do and your family, if you'd like.
Sure. So I'm a general dentist. I've been practicing since 2010. And had a previous career where I owned some practices all over the United States. And then I decided to sell out at the end of 2022 because I personally had quite a bit of difficulty having my son. And we ended up having a baby in 2023. So I sold out of all my old businesses at the end of 2022, focused on him, and wrote a book all about oral systemic health. It was a huge hit. I didn't think anyone would read a book about oral health, but it actually did really well.
Right.
And so I started having people from all over the country reach out saying, where's your office? I'd love to come, have you be my dentist. Mm-hmm. And so I just started thinking, there's not enough biological functional dentists out there. So especially people who specialize in the oral microbiome. So let me build a new clinic. So I, over this past year, I have a brand new office that just opened 6 weeks ago. In Centennial, Colorado. It's a fully integrated functional dental medical clinic. So really excited about that. And so I really focus on specializing on the oral microbiome. We do a lot of saliva testing, and then we figure out how it relates to systemic ailments. And then we work with a team of integrated providers to help make our patients optimally well. So that's what I do. And then I mentioned I have a little boy, so his
Mm-hmm.
name is Roman. He is 2 years old, love of my life, and a husband who is also a dentist as well. And then we
Okay.
have two pugs that live with us.
Alrighty, alrighty. So I want to. We'll get back to like how you. I had never heard of this type of clinic before, and I want to get back to that. But first, I want to talk about because you talk a lot about the link between oral health and how it impacts women's health and fertility. And how did you even get interested in that?
Yeah. So, kind of
Uh huh.
backstory was, when I was 14, I was involved in a four-wheeler accident. And so
Mm.
I ran into a telephone pole head first on a four-wheeler going 35 miles an hour.
Oh
And I
my
ended up
god.
breaking every bone in my face from my eyebrows down,
Oh my
broke a
god.
bunch of teeth, lost a bunch of teeth, was in a coma for 5 days. And they wired my jaw shut in the hospital that night. And over the next 8 weeks of having my jaw wired shut with all broken and missing teeth, I only ate mashed potatoes, ice cream, pudding, and jello. And so, as you can
Right.
imagine, became severely malnourished and emaciated. And that combined with my dental infections, my liver enzymes spiked and my kidneys started shutting down. And so I learned at a very young
Oh
age just
my
how much
god.
your mouth affects the rest of your health. And then when they took my wires off, my jaw had actually fused shut. So I still couldn't
Jesus.
open my mouth enough to brush my teeth or fix them or replace the ones that were missing. And so it took 4 years and 9 reconstructive surgeries before I could open my mouth enough to get a toothbrush in and dental work done. And it wasn't until my senior year, right before prom, when I got my
Mm-hmm.
front teeth, replaced with implants, and got all my dental infection removed from my body that, I mean, instantaneously mental health improved, emotional health improved, physical health improved. And so I said, well, I want to be a dentist. But at the time, there really wasn't this knowledge about oral systemic health, even though I had lived it.
Right.
But I started noticing in my practice that my sickest patients also had the worst teeth. And so I started just diving more and more into, is there this connection? And I stumbled upon
Mm-hmm.
salivary testing. And it made sense because we test the microbiome, we test our blood, we test all these things, but we don't test the bacteria that's in our mouth. And the mouth is the largest entryway to the body. And so I started doing salivary testing, and there was this couple that was referred to me, not to me, but to a dentist. They
Mm-hmm.
were trying to get pregnant, and they were in their 20s. Nothing physically was wrong, but they couldn't get pregnant. And their OB had, enough foresight to say, maybe it's coming from your mouth, go see a dentist. Now, they had no idea who I was. I
Sure.
wasn't advertising that I was doing this. They
Mm-hmm.
just stumbled into my clinic. I tested them, and they had two bacteria in particular that affect both male and female infertility. We treated them, and 3 months later, they were pregnant. And I was like, whoa, this is crazy. And so
Right.
I started doing more and more of that. And then I had my own fertility struggles over six long years working with the best reproductive endocrinologists in the country. And my experience with them was really challenging because they took a very myopic approach to my reproductive system.
Mm-hmm.
And unfortunately, it never did work out for me. And I ended up having to go down the surrogate route. But
Okay.
just being a patient of the traditional Western reproductive endocrinology kind of system and IVF
Right.
and having multiple failures after, and we don't know why, and everything is testing normal. And I really started looking into, what can we do better for women because we deserve better.
Sure.
And just trying to integrate oral health because as a dentist, I was never asked about my oral health. And
Mm-hmm.
before I did my IVF treatment, I actually did some testing on myself and found out I had a root canal that had abscess that I had no symptoms of. I
Uh-huh.
had some bacteria, had to get treated. And so I've just kind of gone down this mission now of trying to do the best that I can in my profession for
Right.
women.
Okay. Wow. That is a story and then some. My
Yeah.
goodness. Well, I'm glad you're here and
Yeah.
doing well, and all of those things worked for you. That's a lot to come back from, and it's such a young age.
At such a young age. I mean, I think about it and I'm like, thank goodness it happened then. I'm 41 now. If it happened now, I'd probably be like, I'm done. I've checked out. I think with your kids, you're more resilient.
Yeah, that is true. Kids are resilient. Kids are
Yeah,
resilient. So then let's talk about how does oral health impact fertility in women? You
sure.
mentioned a couple of bacteria, but how does it work?
So two ways. One is
Mm-hmm.
the actual bacteria themselves affect female fertility and women's health, and
Mm-hmm.
then also the inflammation that those bacteria cause. So what happens is we have a microbiome in our mouth, and less than 1% of those pathogens are actually problematic. But when something shifts that microbiome and it becomes out of balance, so that could be stress, it could be our environment, our diet, or just not having regular dental checkups and appropriate treatment, those bad pathogens can start to grow. Now, if those pathogens make it into the bloodstream, which the bloodstream is connected to the mouth and the gum tissue, so that's why gum tissue often bleeds. The teeth are actually directly connected to the bloodstream as well. So if bacteria get into the bloodstream, either through the gums, or if you have like a tooth abscess, from a big cavity or root canal, those bacteria can circulate and take up residence where they're not supposed to be in the body. So two bacteria in particular, FN and PG, Fusobacterium nucleatum and Porphyromonas gingivalis, specifically impact female fertility and women's health. So it will impact things from endometriosis. 64% of women that have endometriosis have oral FN in their lesions. I had an instance of this in my actual practice, actually. It is related to PCOS. We see difficult conception, stillbirths, preterm labor, and low birth weight babies. And then the other way it impacts it is the inflammation that it causes. So when we have a dysbiosis in the mouth, the immune system is activated because it knows that something is going on that shouldn't be there. So when the body releases the immune cells are really large and can't really make it in between, tight junctions in our tissues. So those immune cells release an enzyme, which is called AMMP8. It's a collagenase enzyme that breaks down our tissue to allow our white blood cells to get to the infection.
Okay.
But when it does that, it turns on our systemic inflammatory system. And then inflammation causes a whole host of issues with cytokines, endotoxins, poor blood flow, you name it. So both ways that the mouth affects it.
Okay. All right. So then, can that also impact, you said endometriosis, fertility? What about pelvic inflammatory disease?
So pelvic inflammatory disease, there it's going to be more of just the systemic inflammation, right? So if you have PID, you have inflammation going on there, but the body needs to be able to quell any type of infection or inflammation. And if you have inflammation in your mouth, it's just going to exacerbate those types of conditions. So that is more of like a correlation, or it's going to make it worse versus direct bacteria causing pelvic inflammatory disease.
It doesn't feel good to be treated like an afterthought, especially when it comes to healthcare. And the truth is, women, especially pregnant women, have been the afterthought in clinical research or left out entirely for decades. That's what makes what Ritual is doing so important. They're setting a new standard with the only leading prenatal multivitamin backed by its own human clinical trial. As an OBGYN, I can tell you, most prenatal vitamin formulations aren't studied. Ritual's Essential Prenatal is different. It's science-backed, third-party tested, and made with traceable ingredients you can actually look up. Plus, it's specifically designed with pregnancy in mind, bioavailable nutrients, gentle on the stomach, which makes it easier to take. Don't settle for less than evidence-based support. My listeners get early access to Ritual's Black Friday sale for 40% off your first month at ritual.com/Dr. Nicole. That's ritual.com/Dr. Nicole for 40% off your first month. Don't miss their best sale of the season. So, what role should oral health play in the conversation about fertility?
Yeah. Oh my gosh. So many, right? And I'm a dentist, so I'm going to of course say that. The biggest thing is a lot of people avoid the dentist when they're trying to get pregnant or when they are pregnant. There's this misconception and this myth that's been out there forever of, if you go to a dentist in your first trimester and you get treatment done, you could miscarry, or it increases the chance of miscarrying. What we know is that's like so false. Since the 90s, it's been proven that it's actually beneficial for people to see their dentist. The reason being is let's start with you're planning to get pregnant. Best time to go see the dentist, because we can do a salivary test to see if you have any of that nasty bacteria that could be impacting you or your partner's infertility. We know that 50% of infertility comes from the male side. and the oral bacteria directly affect their sperm. So we need to test both partners to make sure that they're healthy and clean. We also want to do x-rays to make sure that there are no cavities or that you have no abscesses on your teeth, because things only get worse when you're pregnant. I have many moms that come to me that say, I had no teeth problems until I had my babies, and now my teeth and gums are a wreck, right? I'm sure you've heard that
Yep.
too. So we would like to get you before you're pregnant. Now, let's say you find out you are pregnant, come in. Let us do some saliva testing on you. We'll probably wait to do x-rays until second trimester when it's safer. We totally shield and we use the lowest dose radiation. You know, you're carrying your cell phone every day is worse than getting a dental x-ray. But we can safely treat someone if they have that bacteria present. And what we know is that the bacteria in the mouth and the inflammation that it causes is directly related to how well the fetus develops, to how long you can carry the baby. It also is related to gestational diabetes and preeclampsia. So if you are pregnant, great. Let's help you keep it, and let's help you stay healthy during pregnancy and afterwards. And we know that stillbirths are actually caused by FN bacteria in the mouth. So we really don't have a whole lot of stillbirths anymore, thankfully, in this country, but stillbirths are related to toxic metabolites of oral FN bacteria. So super critical.
I haven't heard of that.
But 60% of, or 40% of women avoid the dentist when they're pregnant, but 60% of women have gum problems when they're pregnant.
So I would say sometimes I see it less and less, I will say, but often I see, or not infrequently, I see dentists who don't want to treat pregnant women. Like they're you're pregnant, you know, like what is that about?
It's all about fear of litigation, right? So you are totally right. There's a very few subset of dentists that actually know about the oral microbiome. So I'll start by saying that. It's not common to be able to find a dentist who does salivary testing and that will treat the oral microbiome, which is a shame, because in medicine, you guys all test. You test for a million different things. And in dentistry, we really haven't started testing. I think the first oral microbiome test was around 2006. It really didn't start becoming even recognized or more mainstream until like 2014, 2015. So this is all new stuff. So we're trying to catch up to the medical profession here. But I think dentists are really afraid of the female reproductive system. And so they're like, you're pregnant. I don't want to touch you. I'll see you after you have the baby. But that's the worst thing that you can do. We know that we can save pregnant moms on average $2,500 if they get their gums and teeth fixed either before or during pregnancy on medical complications during and after birth. So it's very important that we treat those patients, but it's also important we do so safely. So if those dentists don't know how to safely treat a patient, they absolutely shouldn't be doing it. But most dentists do avoid treating women during pregnancy.
Yeah, which I never quite understand, because we try to say like it's worse for her to have this abscess in her mouth. So can you please fix this?
Thank you. Because it's going straight to the, it's blood volume. And we know that a woman's blood volume doubles when she's pregnant, which means more stuff is getting into her system. So if she has an abscess, if she has a gum problem, all that's going to the female reproductive system. So thank you for advocating for dentists to do their job, because we should be.
Yes. So tell me about this saliva testing. I have not heard of this. Is this like FDA approved? Is it off label? Like how does this work? Who does this?
Yep. So saliva testing has been on the market since 2006. It is FDA approved. So it's just like if you do a gut test, right? So you can measure your gut microbiome through the stool or whatever. So now we do it through saliva for the oral microbiome. So the oral microbiome is the second largest microbiome in the body, second to the gut. But it definitely seeds the gut microbiome. You know, it's the largest entryway to the gut. It's the start of the digestive system. There's about a 45 to 50% overlap between oral microbiome and gut. So I always tell people, if your gut microbiome isn't in good shape, you need to test your mouth, because you can't have a healthy gut without a healthy mouth, because you're just seeding it all day long. So it's been on the market for quite some time. There are several companies, and there's more and more coming out every day. But essentially, some companies only test for bad pathogens. Other companies will test for both good and bad pathogens, which I love, because not only do we want to eradicate bad pathogens, but we want to help boost good microbes in the oral microbiome
Sure.
because that strengthens the immune system and helps prevent the patient from having relapse in the future.
Yeah. Yeah, that makes sense. That makes sense. Now, I want us to get to prevention, but before I do that, I want to talk about you talked about it briefly, but can you go a little bit more into how the microbiome affects male fertility? And I'm especially curious because men regenerate sperm
Yeah.
so how does that work?
Yeah. So there was a study that came out in 2025 actually about oral health and male infertility, which I was so excited about
Mhm.
because there's been a little bit of research on it and I've been shouting it from the rooftop. So it's really nice that we have some mainstream studies now.
Right.
Um, but so essentially, one of the bacteria in the mouth, Porphyromonas gingivalis, PG, inhibits arginine production. Arginine is a precursor to nitric oxide. You need nitric oxide to dilate the vessel in the penis to get an erection. So, a lot of times
Okay.
when men have problems with erectile dysfunction, it's usually an inflammatory disease of the body of the vessel, but it's isolated to the penis. So they can't, for some reason, they can't dilate to achieve an erection. One place they absolutely need to test is the mouth to see if they have PG that could be causing that inflammation. So anyone that ever marks ED on their medical history, I'm
Uh-huh.
like, we need to do a saliva test to see. And 9 times
Gotcha.
out of 10, they do have PG for sure.
Okay.
We also know that oral bacteria decrease sperm motility,
Uh-huh.
they decrease sperm count, and they actually change the shape of the head of the sperm, making it less able to
Mhm.
penetrate the ovum. So
Okay.
really important there. And then, of course, we have the systemic inflammatory component
Mhm.
also.
Mhm. And what are these bacteria treated with? Just what type of antibiotics or
So that's I love that you brought that up
Uh-huh.
because what we know is that half of the bad microbes in the mouth are
Mhm.
actually resistant to mechanical cleaning. So in dentistry, whenever we think someone has a gum infection in the past, when especially if we aren't testing for this bacteria,
Uh-huh.
we just do a deep cleaning on them or a teeth cleaning.
Okay.
But half of the microbes that are concerning don't
Uh-huh.
respond to that.
Okay.
And so that's why these patients are never getting better. And gum disease is actually on the rise by about 34%
Mhm.
globally. And so when we get those reports back and we know what bacteria are present, we can tailor a treatment. So we can use medicaments, iodine, ozone is really effective. I love ozone. We can do tissue lasers. We can do localized antibiotics like minocycline, systemic antibiotics, or systemic inflammatory agents as well. So totally
Okay.
just depends on what's there.
Okay. Okay. Very interesting. All right. So let's talk about prevention. What are the most overlooked habits or dental routines? What are the things you want people to do that could help support fertility specifically?
Absolutely. So I always say biggest thing, get tests. So you can
Mhm.
get some tests over the market. You can also look for a dentist who does salivary testing,
Mhm.
or you can do telehealth testing through myself. Other big things that people can do is your teeth are your only non-shedding surfaces in the body. So your skin turns over, your
Mhm.
hair turns over, your
Mhm.
gut turns over, but your teeth don't turn over. So unless you're getting in there frequently to mechanically clean them with by a professional like a dentist or a hygienist or yourself, you're just allowing that biofilm to build up. And the longer you go in between mechanical disruption, the
Mhm.
more bacteria come on the scene and the stronger that microbe community gets. So brush
Gotcha.
more frequently and more often.
Mhm.
The biggest thing that everyone hates to hear, but it's so true, is that you have to
I
floss
knew you
at
were going to
least.
say that.
No, I know you're hit the cancel button, put you in the meeting. But the toothbrush only gets 3 out of the 5 surfaces of your
Uh-huh.
teeth. And the two most important surfaces are the ones that are directly adjacent to your bloodstream, which is your gums. So you have this
Mhm.
pointy thing in between your teeth called the papilla.
Mhm.
That's where your blood supply is, and that's the most important surface to clean. And the only way to clean that is to either A, floss, or B, water pick. So I tell people you must floss or water pick twice a day. And when I say floss, I mean like string floss, not
Right.
floss picks.
Got it.
Floss picks are great to remove something from in between your teeth after lunch.
Uh-huh.
But all you're doing, if you just floss pick all your sites, you're moving bacteria from one site to the next.
Okay.
So you want a really long piece of floss
Uh-huh.
that every time you pull it out, you get to a clean section.
Gotcha.
So flossing is probably the most important thing that you can do.
Okay.
And then making sure that you're using gentle, alcohol-free, chemical-free products, because if it says kills 99% bacteria, it's killing everything, including the good guys.
Okay.
And then the bad ones are going to repopulate. So
Gotcha. So do you not recommend like Listerine or?
no. So they make Listerine Zero
Uh-huh.
now, which is alcohol free,
Okay.
which is much better. So
Uh-huh.
just try and use something that's alcohol free. You can definitely go even more. I call it crunchy.
Uh-huh.
I'm from Colorado, so we say, crunchy organics. You can go something even more crunchy
Right.
and go chemical free, which is obviously going to be the best for you. So there's lots of great products like Boca is really good. TheraBreath is good. Rise Well, Feed Your Good Guys, Revitin. There's lots of Super Tea. There's a lot of really nice organic, gentle products on the market these days.
Okay, I'm just learning all kinds of things here.
Yeah, that's
Okay. All right. So, are there any treatments or procedures in dentistry that could actually worsen someone's health or really someone's fertility if we're not like paying attention to their overall health? Like, is there anything that, like, wait a minute, before we do this, let's look at the bigger picture?
a great. I don't think I've ever got that question before. That's a really good one. Um, I would say a couple things. One is make sure you're getting the right type of cleaning. Oftentimes, a lot of dentists brush bleeding gums and gum infection under the rug and just say, oh, brush and floss more. We're going to do a regular
Uh
cleaning.
huh.
Regular cleanings or prophylaxis cleanings, which is what those are called, are cleanings above the gum line. Those microbes aren't the ones we're concerned about. We're concerned about the microbes that live beneath the gum line that are getting into the bloodstream. So if someone has bleeding gums, something needs to be done to that subgingival microbial community. So
Okay.
making sure that the cleaning that we're getting is the appropriate cleaning, because oftentimes it's not.
Gotcha.
Making sure we're using adjunctive therapies to clean properly. And then, of course, we want to make sure that we are not getting mercury silver fillings. That's going to be a big one. Don't ever get a silver filling. That's terrible for your health.
Okay. Are those still done?
They are.
Okay.
Yeah.
Okay.
Unfortunately. Yeah, not as common,
Right.
but
Right.
yeah. And on the flip side, if you get those taken out, you want those taken out
Uh
safely,
huh.
and you want to make sure you're detoxing your system afterwards. Like I'll have some people come and they'll say, I went to this dentist and they took out all my amalgams, and I said, well, did they use isolation? Did they use, air evacuation? Did you do any kind of chelation therapy afterwards? And it's no, no, no. And it's like, you get more mercury into your system after you take the fillings out initially. So you need to get that out of your body. So that's critical. And then making sure that if you have root canals, that they are being monitored frequently. Because like I said, in my own body, I had an abscess on an old root canal and had no pain, no symptoms. And
Gotcha.
if I wouldn't have taken a three-dimensional x-ray on myself,
Uh-huh.
nobody would have caught it.
Okay.
And that's even more damaging to your health
Right.
than gum issues are.
The countdown is on. Holiday shopping season is officially here, and Uncommon Goods takes the stress out of gifting with thousands of unique, high quality finds you won't see anywhere else. What I love about Uncommon Goods is that everything feels intentional. These aren't your run of the mill gifts, they're thoughtful, creative, and often handmade by independent artists and small businesses. When I was looking through the site, I saw the perfect first gift from you to your baby. It was a personalized goodnight book. It features your child's name on the cover, throughout the story, and even in illustrations. You'll be able to read this with your baby from the day they come home from the hospital and for years to come. And Uncommon Goods doesn't just have great gifts. With every purchase, they give back $1 to a nonprofit of your choice. Over 3.1 million donated so far. So don't wait. Cross those names off your list before the rush. To get 15% off your next gift, go to uncommongoods.com/Dr. Nicole. That's uncommongoods.com/Dr. Nicole for 15% off. Uncommon Goods, we're all out of the ordinary. Now, I want to end with a couple of just random questions. So, you said your practice is a integrated functional dental, I'm reading it, integrated functional dental and medical center. So how does that differ from a traditional dental office? I know you said you have other practitioners. So what kind of other folks are you working with in this
Yep.
environment?
So we do, everyone that comes in through dentistry gets a sleep apnea or a sleep test.
What?
Airways. Oh yeah, every airway is so critical for dental health, brain health, heart health, and fertility. So we
Okay.
test, and 80% of the people who have airway issues don't know it. They're
Yeah.
undiagnosed.
Mm-hmm.
So everyone gets an airway test. Everyone gets three-dimensional CB or three-dimensional X-rays, so we can check for airway and abscesses and sinus issues.
Okay.
So we're a big airway facility, a big saliva test, microbiome facility. Obviously, we
Mm-hmm.
test that. But then I have a medical director that oversees the medical side. I have a naturopathic doctor that will see patients for medical issues. I have a nurse that does IV therapy to help patients heal after procedures and to detox after procedures. And I have a certified nutrition specialist who I love. She's a miracle worker. She does all the gut testing,
Mm-hmm.
tests for toxins, parasites, metals, hormone imbalances. And then she creates nutrition and supplement plans to help the patients get well. So her and I work in tandem. And I always tell patients, you can't brush and floss your way to good oral health. You have
Uh-huh.
to eat your way there.
Yeah.
So if someone has an oral health issue or a gut issue, her and I are working together to get that patient healthy. And then I have a myofunctional therapist who is a dentist that, well, she is a dentist that specializes in myofunctional therapy, which is essentially a physical therapist or a personal trainer for
Uh-huh.
your mouth. So it helps with
Interesting.
airway
Right.
issues.
Right. Okay. All right. So interesting. And then um the other thing I saw in your bio is that you work with dental technology companies. Is there anything that's like fun on the horizon or interesting that you'd like to share
Oh,
coming in relation to dental health?
yeah, so much stuff. So, I serve as the chief clinical advisor for a VC company called Dental Innovation Alliance. And so, what we do is we go out and we source these dental technology companies to see if they'll be disruptive and help improve patient outcomes in the
Mm-hmm.
dental industry. So, oh gosh, what are some things that people are doing? So, a lot of saliva testing is out there.
Uh-huh.
A lot of robotics are coming into dentistry for tooth preparation and for surgery.
Okay.
That's really great. There's some sleep apnea devices coming out that, we have the tongue implant that you can do.
Right.
There's lasers for oral surgery.
Okay.
There's a device that you can put in your mouth to strengthen your tongue. Lots of software stuff.
Uh-huh.
AI on x-rays is really, really big.
Mm.
So yeah, lots of stuff on the horizon.
Okay. Interesting. Interesting. So then as we wrap up and I ask my guests all these questions, what is the most frustrating part of your work?
Um, Frustrating part, although it's not getting as frustrating
Mm-hmm.
anymore, but just trying to get patients to understand the importance of their oral health
Mm.
as it relates to their systemic health.
Mm-hmm.
Oftentimes, dentistry is an elective healthcare procedure, just like your eyes, which doesn't make sense. You need
Makes
your
it
eyes
makes
to
no it makes
see.
no sense like
Um,
whatsoever.
yeah,
Yes.
yeah. But people will spend money on things that they want. So iPhones, computers, TVs, cars.
Yeah.
But a lot of times they'll say, "Oh, it doesn't hurt. I'm not going to fix it," or "I'll wait till it breaks." So that gets a little bit tough. But I will say that is changing. People oftentimes are coming into the dentist first now instead of medical providers. So
Okay.
that's exciting.
Okay. Okay. And then on the flip side, what's the most rewarding part of your work?
When someone comes in and they are sick and they have all these symptoms, but they can't get a medical diagnosis because they
Mm-hmm.
don't meet any certain criteria,
Right.
and we figure out the root cause and we fix it and they feel better.
Okay.
I mean, I had
Yeah.
a patient leave my office yesterday who's had all these issues for a long time, and I did some red light therapy on her mouth. She had a gum infection, did some red light therapy, and immediately she felt better.
Okay.
And she's like, I've been looking for this for years
Right.
and
Right. Right.
I've never felt better. So yeah.
Oh, good, 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 good. So then, what is your favorite piece of advice that you would give to either someone who's trying to get pregnant or pregnant about caring for their oral health?
Um, Number one, make it a priority for sure.
Mm-hmm.
And I think in general, my advice for any woman trying to get pregnant that it's been really tough is turn over all the rocks, right? So just because you see one type of provider doesn't mean that that's the end point. And I wish someone would have told me that when I was going through it.
Sure.
There's many things that can affect your overall fertility. And so make sure you're doing your research and turning over all the rocks because, you want the miracle at the end of the day. And it might take several different modalities working together to get you there.
Yeah, definitely, definitely. So where can people find you?
So my practice website is collectivehealthsociety.com.
Mm-hmm.
But if people want to work with me personally with saliva testing, telehealth, that website is katieleedds.com, dentistsurgeon.com, or Instagram is a good place, Katie Lee DDS on there.
Okay, and we'll put all that in the show notes. Well, thank you, Dr. Lee, for agreeing to come onto the podcast. This was a great conversation, super informative.
Thanks for having me. I appreciate it.
Wasn't that a great and insightful conversation? I really enjoyed it. And after every episode, when I have a guest on, I do something called Dr. Nicole's Notes, which are my top takeaways from the conversation. Here are my Dr. Nicole's Notes from my conversation with Dr. Lee. Number one, we ain't talking enough about how oral health impacts overall health, including fertility, and that really does need to change. We know that at least 2 oral bacteria are strongly associated with infertility, endometriosis, PCOS, stillbirth, and preterm birth, and that they can actually affect both partners. So if you're trying to conceive, your oral health should be part of the conversation. And even if you're not trying to get pregnant or you're already pregnant, it needs to be part of your overall health plan. Your mouth isn't separate from the rest of your body. All right, number 2, inflammation in your mouth equals systemic inflammation in your body. When you have chronic gum issues, that inflammation doesn't stay local. It ramps up your immune system responses throughout your body, and it can create an environment that can disrupt conception and potentially cause issues during pregnancy, like preterm labor or preterm birth. So this isn't just about cavities. Again, it's about systemic health. Number 3, let's all make sure we're covering the basics, okay? Let's brush twice a day, floss with the long strings, not the picks, so you're not just transferring bacteria from one spot to another. Ditch the mouthwash that says it kills 99% of bacteria, because that actually includes the good bacteria too. Those harsh alcohol-based rinses may throw off your whole oral ecosystem. Think of your mouth more as a garden. You need balance, not bleach. And then the final part is that dentistry needs to step up, but so do us OBs. Too many dentists are afraid and really terrified to treat pregnant patients. They fail to remember that the most important piece to a healthy baby is a healthy mom. So if mom has a health issue in her mouth that needs to be taken care of, it needs to be taken care of for the benefit of her and the baby. But on the flip side, too many OBs, we aren't asking about oral health either, whether it's in the preconception period and making sure you're getting those regular cleanings or getting that regular cleaning while you're pregnant. We need to talk about it. We need collaborative, integrative care that is based on that holistic approach to health. All right, so that is it for this episode. Thank you so much for listening today. If this episode helped you, share it with a friend, hit subscribe so you don't miss a thing. And if we're not connected yet, come follow me on Instagram. I'm on Instagram at Dr. Nicole Rankins. My DMs are wide open, and I truly love hearing from you. Now, do me one more favor and come on back next week. And remember to trust your power and take charge of your birth.